makes me wanna holler, go away. I need more peace and hope and love. Where do I find it in this crazy old world? I need strategies, strategies for living radio. Your dose of radio rehab. Strategies for living radio. Every time I listen, Lauren and David share strategies for living, and it makes me aware. I got strategies for living, strategies for living radio. Your dose of radio rehab. Strategies for living radio. Your dose of radio rehab.
You know, we need them. Yeah, we need those strategies, don't we? Those strategies for living. So, are you ready? Are you ready for your daily dose of radio rehab?
You know, I feel kind of magnetic.
Ah,
is there some kind of magnetic pull in
there may be a reason for that.
Yeah?
Hey, folks, stand by with that.
Okay.
Hey,
All
folks,
right.
welcome into another edition of Strategies for Living. I'm Dr. David McMillan. She is psychotherapist, LPC Lauren Leon McMillan. Funny you should mention magnet. Have you heard of TMS?
Yes, I have.
Yeah.
But maybe I should say no so that you can explain it.
No, if you've heard of it, then you know that it's for treatment-resistant depression, OCD, PTSD. It's Neurostem TMS therapy,
Right.
and we happen to have Kathryn Thomas with us today here as our life strategist, and she is all things Neurostem. And we're gonna it's fascinating because this is a non-drug, non-invasive option for people struggling with.
And very powerful.
Oh my
So I've
goodness!
heard.
I mean, you and I have, and we've talked about it on the program. We've messed around with just smaller magnets,
Right, with pairs of magnets.
and pairs of magnets,
And we know we're biomagnetic electric beings.
We are.
So.
We are indeed. And so the what this is offering to the Shreveport community is extraordinary. And Kathryn is here today.
Oh, I'm so looking forward to it.
Yeah, and we're going to learn all about Neurostem and about TMS, and its arrival in the Shreveport Bossier City area.
Sounds like a good show to me. I'm looking forward to it.
I think we've got a plan. I think there's a plan afoot.
Okay, put those magnets away for now.
Okay, I will. Folks, thanks for tuning in. We appreciate you being with us today here on Strategies. And we appreciate our sponsors who make it all possible. The Robinson Film Center, Azalea Cleaners, Pintail Roofing, Restore Healing, SRT Sales Training, Uprising Addiction Center, and Mira Direct Primary Care. We're coming back in a moment. We're going to learn about Neurostem, Transcranial Magnetic Resonance. Can you say that?
Say it 3 times fast now.
I have a hard time, but Kathryn's going to deal with me here today on Strategies for Living. Be right back.
Tune in daily, find the light. Healthy mind and spirits bright. Strategies for living strong. Feel the vibe, it won't go wrong. Body moves and soul align. Catch the rhythm, feel the time. Radio rehab every day. Chase those clouds of gray away. Your daily dose of radio rehab. Lift you up when skies seem trapped. Mind and body, spirits free. Living life in harmony.
And welcome into Strategies for Living. Lauren Leon McMillan, David McMillan. Let's welcome into the program Kathryn Thomas, licensed professional counselor. She is the clinical director and owner of Neurostem. She brings over 17 years of medical startup experience to Neurostem. combined with several decades of clinical experience. She's excited over this treatment option of TMS due to the significant number of success stories from patients who have suffered from debilitating disease of depression and have struggled to find any kind of meaningful improvement. Kathryn founded the Healing Clinics in Shreveport in 2018, has opened additional clinics all over the state of Louisiana and Mississippi, and we're glad she settled down enough to bring Neurostem to Shreveport. Kathryn, welcome.
Thank you so much, David and Lauren. I'm very excited to be here with you today and talk to your audience more about transcranial magnetic stimulation that we now have available in the area.
It is, I mean, number one, so many people, struggle. I'm preaching to the choir here, to the two of you, so many people struggle with depression. So many people struggle with anxiety. Also things like, not being able to quit smoking and stuff like that. We'll get to that later. But just the piece of chronic depression, chronic anxiety, and we don't bash anybody here. I think some of the pharmaceuticals available are wondrous, but I mean, let's face it, they don't work on everybody.
They come with side effects, and they have their limits.
There you go. And so for what this brings to our area, is it's magnificent. Give us a little tour of TMS therapy in general, transcranial magnetic stimulation. How old of a treatment is this, Kathryn? I know you've just recently brought it to Shreveport, but how long has it been around out there, and how much has it been studied?
Okay. So just for a little background, most clinicians will tell you that a part of their practice, huge part of their practice, the biggest part of their practice usually is treating patients with depression.
Yes.
So if you are a clinician and you say 60% of your patient population is suffering from depression, out of that 60%, there's a decent amount, let's say 40% often, that just are not responsive to the medications.
Right.
So if you told your patients that were suffering from depression, the medications can help you some, but they'll probably only get you to about 70% of your maximum capacity for joy.
Right.
That's pretty depressing in and of itself, right?
Yeah. You're depressing me now, Kathryn.
Yeah, exactly. So, in behavioral health, and you guys know this, the advent of the pharmacy treatments for depression were huge because up until then, we just didn't really have anything besides talk therapy that really was used for treatment.
It was
depression.
A game changer when Prozac and Zoloft and all those came on the scene.
Yes, so we're so grateful for that.
Yeah.
Then in the mid '80s, they started doing some of this transcranial magnetic stimulation, which is the idea is it's an electromagnetic stimulation to your brain, which creates new neural pathways and can also increase the neuroplasticity of your brain. So our idea is that if we can create these new neural pathways and increase that neuroplasticity of your brain, huge, right? So it's
massive.
Pretty much the biggest thing that's come to behavioral health, in my opinion, in decades.
And I could imagine that would actually increase your ability to make progress in talk therapy too.
Exactly. So the idea is a little bit about TMS therapy. So it was started in the mid-'80s, about 1985. But the problem then was it was not FDA approved.
Right.
Insurance companies were not covering it.
Right.
And the research really wasn't there. So fast forward to 2026, and now it is FDA approved to treat depression, major depression, PTSD, OCD, and even nicotine addiction.
Wow.
So the idea is when you get finished with this TMS, exactly, Lauren, that then your patients are even more ready for talk therapy because their neuroplasticity of their brain
they're more open.
Exactly.
Yeah.
And along the way, we've got to underscore it's non-invasive.
Oh, it's non-invasive. There's no anesthetic required.
Right.
Unfortunately, Electroconvulsive therapy has sort of made a comeback, right?
Oh,
So
wow.
that's very difficult. It's very difficult for the patient.
Yeah.
So this is not that at all.
No.
So nothing like that.
No,
so,
in fact, you're completely conscious
you're completely
and awake.
conscious. So honestly, you drive yourself to the appointment. You don't have to have anybody to drive you. You're going to take your session, which is going to last about 19 minutes.
Mm-hmm.
Then you're going to drive yourself back to your job or your home or whatever, or go do something fun, right?
Okay.
Do some people who come in and get a session, do any of them feel it right away, or does it generally take a few sessions?
So both, right? So there's
Okay.
some patients who say right away, I definitely feel better. I've actually tried it myself. And after the very first session, I definitely felt, I said, I feel euphoric and calm all at the same time. It's
Yeah.
really pretty marvelous.
Yeah.
Interesting.
So, so there's no anesthetic involved. We do need, if you have a physician, please do talk to your physician about it. You're not eligible for it if you have metals in your head,
Right.
Oh, sure.
things like that. So
Right.
we'll do a pre-screening with you, and insurance is covering it. So we'll do all the prior authorizations and all that.
Right.
It's
So-
36 sessions, I apologize.
Okay.
And you really do need to come every day for those 6 weeks.
Right.
So it's pretty much, you
So
have
it
to
kind of builds.
it builds,
And
it definitely builds.
In that 19 minutes,
Mm-hmm.
this incredible system is delivering magnetic pulses to very specific areas of a person's brain.
This is completely 100% individualized treatment.
Okay.
So what we're going to do, we're going to take some measurements of your head and
Right.
different things, and we're going to enter those numbers into the software
Yeah.
and exactly why you're coming. And then we're going to determine where your motor threshold is. And that's different for every single person.
Right.
So we have a general part of your brain that we're targeting, but then we're going to make it very specific for just you, David, or just you, Lauren.
Okay.
So we're going to find out where your motor threshold is. And
Right.
that's where then we're going to reduce the pulsations, the intensity of the pulsations, and that's where you're going to get the treatment.
So the motor threshold is the point at which you can stimulate the muscles?
That's
or?
correct.
Okay.
That's correct. And
Okay.
it's different. It's different for every
Yeah.
person. It's
Okay.
also different what degree of stimulation you need for that to occur.
Okay.
So that's all individualized.
And I had a guest many years ago. In fact, his name was Daniel Amen. Some people will know that name. But he said here on the radio, he said, you change your brain, you change your life.
Exactly.
And I can't think of anything that has the power to change our brain like this. We're talking mood regulation.
Yeah.
We're talking cognition. We're talking, because if I heard you correctly a moment ago, you said neuroplasticity. So it even changes the way that our brain works.
Yes. Correct.
Wow.
Yeah, it is. It is. Wow.
Wow.
That's the reason why I got into it in the first place, honestly, because when I heard about what it did, and I did more research and I started doing more reading and just talking with some people who had tried it, and certainly everyone in the behavioral health world, and starting to talk to everyone about it. And I was just hearing these remarkable results. And then I got into it and we started treating a few patients, and I thought that the number of sessions would be a barrier to treatment.
Right.
But every single person we have that is involved in it or has tried it never wants to miss an appointment. They just don't miss.
Well,
They feel so much better.
And I'm not, of course, obviously, I'm not talking about anybody individually, but over the 30 years that I practiced, I can't even begin to tell you how many people I dealt with depression and anxiety. And I'm talking the number that I dealt with chronic
Yes.
depression, chronic anxiety,
Yes.
and PTSD.
Right.
And I can think, immediately of this person, that person, this person, who would, in a heartbeat,
Right.
say, "Oh,
Yeah.
36 sessions, that's nothing."
Right.
Compared to what-
Compared to the years of
Yeah.
psychotherapy. Yeah.
So true.
Yeah.
Yeah.
So true.
I mean, I had a number of clients that I saw for 14, 15 plus years.
Right.
And we're talking weekly and sometimes 2 times a week.
Right.
So when something shows up that can break through that, wow.
Wow. And particularly if you've tried as many different pharmaceutical approaches and you're just not getting any relief. And like
Yeah.
you said, the side effects those can be
And
devastating.
then you have to take medications for the side effects, right?
Side
Yeah.
effects. And we're going to work hand in hand with your therapist or your psychiatrist,
Right.
and make sure that they know about the treatment and that you're involved in it. We really appreciate a referral from those treatment providers if possible.
Does this need obviously it's a great idea to talk to your physician. If you have a psychiatrist, talk to him or her. But is there a prescription needed for this?
There is, and we have a psychiatrist in the company,
staff?
on board, on staff, that will get you your prescription for that. And then we start all the prior authorization process with your insurance company as well.
Now, folks, while we're talking to Kathryn today about Neurostem, if you would like to jump online, I invite you to do that, neurostemllc.com. It couldn't be more conveniently located either. 745 Olive Street, second floor. Everybody kind of knows that building. You may not know it right now when I mention it, but when you pass, that building. So convenient for everything, close to 20, close to 49. So, but www.neurostemllc.com. While we're talking, that's where you can get more information. But don't go away. Just pull up the website and stay here with us on Strategies, because Kathryn Thomas is our life strategist today. Neurostem. It's a new kind of therapy. It's revolutionary, and it's in Shreveport, right here. We're going to talk about it more here on Strategies. Strategies for Living. Don't go away. And welcome back into your daily dose of Radio Rehab, Strategies for Living. Lauren Leon McMillan, David McMillan, our life strategist today. We are so happy to have Kathryn Thomas with us here in the studio, but I'm even happier that she picked Shreveport for this wonderful TMS and bringing it to the Shreveport area. And I hear people saying, TMS, what? Well, it's a new kind of therapy. If you're just tuning in, check out neurostemllc.com, and that's STEM, STEM, like brainstem,
Right.
Right?
Yes.
And, it's Transcranial Magnetic Stimulation. You may think, some people have even probably said this is magic, but it's not. That's what TMS is. May feel like it to you because I would imagine that after a few sessions, people's world that was once dark or scary is now light and breezy. And wow.
It's compelling.
Powerful stuff.
Powerful.
Yeah.
How do I know, Kathryn, if TMS is something that I really should be considering?
That's a great question, David. And I think the first step is, are you getting the response to your depression that you would like to see from your medication or talk therapy or whatever you're doing?
Right.
The next step, I think, would be to talk to your provider, your psychiatrist or your therapist, and understand that this is an adjunctive therapy that we're doing in coordination with your current psychiatrist.
Right.
Or
This does not
therapist.
replace.
100% not. We
Yeah.
do not want to replace. This is just an adjunct treatment.
Right. Well, because I can imagine from a biological perspective, when you're increasing neuroplasticity, how much greater synergistic any other treatments you add on top could then therefore be.
That is so true, Lauren. And that's exactly what we want to do. We want to work hand in glove with your current provider and your therapist, and just strictly as an additional therapy for you to see if it works. And so I think that would be the first step, is just to ask yourself, are you where you want to be? And if not, talk to your provider and see if this might be something you could try. And there's no charge for us to consult with you or to walk you through and let you see the machine or anything else and get a good consultation with us.
Yeah. So come on in and meet, and
Sure.
there's nothing to lose,
Nothing
right?
Well,
to- nothing.
there's nothing. Is there really nothing to lose? What are there any possible side effects or any possible negative effects of TMS?
Well, that's a great question. Sometimes they say that you get a mild headache. We haven't had that happen with any of our patients yet. And sometimes at the site of the stimulation, you could experience some soreness a little bit. We have some numbing cream if that happens, but we haven't had that happen yet either. So,
And it's interesting because with neuroplasticity, I mean, I can hear some listeners right now. After a few years, you kind of develop this. I don't know what to call it.
A sixth or seventh sense for the audience in your ear.
So I'm hearing Ben say, "Wait a minute, I've got a mother or a father who's just been diagnosed with, with dementia, and so you said neuroplasticity. Can this help? Can this help my folks?"
they're doing so much research as we speak with TMS and dementia and other, brain-involved diseases, and they're seeing magical results. So certainly we're using it off-label. People use it off-label for dementia and, seeing some pretty amazing results.
All right, now you said you can drive yourself to your appointment.
Absolutely.
You don't need somebody to drive you away. You can drive yourself
Drive
home.
yourself there.
Is there anything, I mean, when I step out of my session, is there anything that I need to be aware of is there any restrictions from anything, when I head home?
No, not one thing.
Wow.
So I can go about daily life.
Just go about daily life and feel a little bit better doing it.
Yeah.
And what are does this last?
So that's another great question. The research shows that that's also individual.
Okay.
So for many people, that's you're one and done. You get your sessions and you never have to have it again.
Yeah.
For other people, maybe you need what I would call a tune-up in a year.
Yeah.
We're happy to provide those for you if you were to need an additional session after a period of time. So that's going to be individualized to you as well. And I would really think that, as you mentioned a minute ago, using this in conjunction with therapy, that's a great thing your therapist could keep track of too.
Yeah. And I would think it would be more likely to bring about lasting change, because if you've got more synapses available, and then you actively use that in whatever other therapy, whether that's talk therapy or hypnosis or some other adjunctive therapy, that's going to reinforce the new connectivity.
Exactly.
I would think that would.
It does.
Yeah.
I agree with that 100%. Well said.
Now, Kathryn, I know because you and I chatted a bit on the phone, and you did some bragging about your team.
I have such an amazing team. They're easy to brag on.
Well, I could tell by talking when we chatted that you have assembled quite a team.
Yes.
To take care of folks
Yeah.
that come to Neurostem.
Yeah, we have a fabulous psychiatrist who actually did her residency at Yale. So she's just amazing. And then we've got the office staff has been trained in the provision of this treatment, and also amazing. We just have an amazing group.
So you make an appointment and you come in.
Yes.
And you mentioned it's less than half hour, less than a half hour.
The first session we do something called mapping.
Yeah.
And that is where we
longer
It's
then.
a little bit longer.
Yeah.
So that mapping session is probably going to take about an hour
Okay.
because it is completely individualized.
Right.
So an hour to an hour.
Are you going to poke me with needles and
no
stuff like
needles.
that?
I don't need any needles or blood tests or anything like that.
Okay.
Completely painless again.
Okay.
No
All right.
anesthesia. But we are going
All you're going to really do is take some measurements
That's right.
and stuff like
Take
that.
some measurement and find that motor cortex. And then, so that's why it takes a little bit longer, because it is individualized just for you.
Right.
Yeah.
So rather than just coming in, I'm going to do it the same place to every single person. Nope, that's not how it works. We're going
Right.
to individualize it to your
Because you're
care.
aiming at specific areas in the brain.
That's right. Yes.
do specific functioning. And
Mm-hmm.
folks, think about this. Everybody's ears aren't the same.
That's right.
And so you measure from ear to ear,
sure
or
do.
you measure from what's called is it called the Enion?
I think so.
yeah.
Yes, that's correct.
So you take those measurements,
the
and then
back of
you
the
can.
head.
What's
Which
that?
is the back of the head.
The
for
back of the head,
listeners.
yeah. So you that way you can compute exactly where specific brain points are.
That's exactly
And there's a
right.
bunch of them in the brain.
Yes.
And you're
yes.
targeting specific ones for depression,
That's
for
right.
anxiety.
That's right.
Are there different ones targeted for different things? Like if I come in and I want to stop smoking.
That's a different area.
Okay.
So
All right.
we'll target that area specifically to you as well. So that's where it becomes really, really individualized, depending on what your needs are at that time.
Yeah.
And also to add to this, after a couple of weeks, we're going to check in and see how you're doing.
Yeah.
Are you noticing some differences? Tell us what kind. What are you noticing?
Yeah.
And your therapist or psychiatrist will also be keeping up with that. Tell me
Right.
what you're
Right.
noticing. So as a therapist, you might call, me and say, hey, so-and-so, my patient so-and-so is just really not seeing the results that they would like to see. So then we're going to remap. That's the psychiatrist does the mapping.
Right.
And so we're going to remap
Making
you.
sure everything
Yes.
is exactly where it's supposed to
make
be.
sure we're doing our part. And if
Right.
you have a change in your medications, we're going to need to know about that too.
Sure.
Because the medications, a change in your medication can influence the efficacy of the treatment.
Sure.
And some people may wonder, well, medicines are so good, and my doctor has me on 5 or 6 of them.
Right.
I remember several years ago, very prominent local psychiatrist said to me, we were having a conversation, and he said, David, he said, one medication, and I pretty much know what's going to happen. 2 medications, not so much. 3 medications, he said, it's a crapshoot. His words.
Yeah. Yeah.
And I can't even begin to tell you through the years how many people came in to the office and they're on 10 different medicines or 15 different medicines because we're in an age of specialization. And each one of those specialized physicians have their grouping of meds. Okay, do this. And so...
Yeah, and for that patient that comes in and they just are still not feeling any better, so to speak, and they say, I'm feeling about the same for their depression, say a dysthymic patient.
Right.
We're just seeing pretty remarkable results with dysthymic patients because those are folks that have been on medications for maybe decades.
Yeah.
So I have to just share this story of the patient that said that he was leaving the appointment. He saw like a beautiful flower or something like that. He thought, what a beautiful flower, because he just it was such a sense of joy that he hadn't ever experienced.
Yeah.
So that's just such a small thing for us, right? That
Yeah,
we can,
but it's huge for patients who hadn't felt that.
exactly.
Yeah.
So when all of a sudden they start feeling that bit of difference after decades of all kinds of medications and things, it makes a difference.
Yeah.
You don't have to suffer silently anymore.
Right.
Not when there's so much help available. And now TMS is in Shreveport. It's called Neurostem. TMS is Transcranial Magnetic Stimulation, done right here. We're talking to Kathryn Thomas today and learning about all things Neurostem. Conveniently located at 745 Olive Street on the 2nd floor. Go to neurostemllc.com. Got a nice website. And so, you get to know those people we were talking about, and they all do have friendly-looking faces. I'll say that.
And it makes a huge difference, right? When you can go into a place where people are friendly and
Absolutely.
care about you.
Check it out, neurostemllc.com. But don't go away from us because Kathryn Thomas is with us for the entire hour, and she's coming back as we are here on Strategies for Living. Be right back.
We all have problems every day. We all need help along the way. We need strategies, strategies, strategies for living radio.
And welcome back. Welcome back into Strategies for Living. Lauren Leon McMillan, David McMillan, with the owner of Neurostem. She's Kathryn Thomas. And look at here. We've got a brand new person in the room, Benita Collard, who is the marketing director of Neurostem. Benita, welcome.
Thank you.
Glad you're here.
Thank you. I'm excited.
You can keep us straight now. If we veer off, you can, push us back straight. Put that marketing hat on. All right. Couple of things, ladies. We've talked about depression. We've talked about anxiety. Specifically, there's an anxiety disorder. It's called OCD, obsessive compulsive disorder. And, some of us joke about having OCD. And for some of us,
It's not a joke.
it's not a joke, Neurostem treats anxiety as well as OCD, right?
That it does. It's FDA approved for OCD.
Wow. That's massive.
It's huge.
I
Yeah.
can't help but think as we're talking about this, do you think maybe not now, but in hopefully perhaps the near future, maybe we'll move from a place of treating, well, I have depression or I have OCD or I have PTSD, to recognizing, well, there's particular neural pathways that are misfiring and treat those instead of the particular diagnosis.
I like that a whole lot better than the label.
I do too.
Yeah.
And I can't see how we couldn't possibly not
Yeah.
do that.
That may be where technologies like you're bringing are heading us.
That's
you
right.
know?
And Duke University is really leading the way on research in this. And that's where our psychiatrist trained, was at Duke University to do this treatment. And with all that research that they've got going on, I can't imagine that it wouldn't end up where you're suggesting, Lauren.
Yeah.
I hope so.
Yeah, and how much of a different paradigm shift would that make for our patients?
Exactly.
Yeah.
Exactly.
Now, Benita, insurance does cover this, right?
Yes, we accept most major insurance companies, and we also have a cash pay plan if that's needed as well.
Fantastic. What about Medicare and Medicaid and stuff like that?
We accept those also.
Oh, wow. So it's across the
accessible.
board. It's
Yes.
accessible to. There's nobody that's listening to us right now that it's not accessible to.
Absolutely.
And you didn't say this, but I've already gotten to know kind of the folks that you are. You're not gonna say no to anybody. You're gonna try to work with them and come up with a plan that will work for them and their budget.
Yes.
Yeah. Okay. So there you go.
Yeah.
It's called Neurostem, and you can find out more about it at neurostemllc.com. There at 745 Olive Street.
Are there any misconceptions about TMS that you would want to clear up?
I think that's our biggest obstacle is the education piece.
Yeah.
It's just so many people have not heard of it. Most of our patients come to us because they are searching online for a different treatment for their depression or their OCD, their PTSD. So that's how they get to us. But for those folks who are just listening and just wonder about it, that's why this is so great to be able to talk about it today.
I'm
Well,
so
we
glad.
hope we'll be back.
Yeah.
Yes, thank you.
I'm glad you mentioned PTSD again, because Lauren and I end up talking a lot about PTSD, and forgive us for the saying, but we say all God's children got PTSD.
Absolutely, I agree.
Some of it is little T trauma. Nobody can get out of life without some little T trauma.
Exactly.
But a lot of people have big T trauma, and anybody that has it, what I'm talking about. You know who I'm talking to. And when you have big T trauma in your childhood, even early adulthood, or even somewhere along the way, it's very, very difficult to get past it.
Yes, so many people become defined by that.
And this helps, right? This is a proven treatment
It does.
for
It's
PTSD.
it's FDA approved for that. So
Wow.
it does help, yeah.
Yeah.
And we would want them to work very, very closely with their therapist
Sure.
while they're getting this treatment for that, for sure.
And I specifically am talking to the therapeutic community now. Anyone who has been on that side in the therapy room, in the counseling room, you really want to help.
Yeah.
And you really want to see change in people's lives. And you know as well as I do, we all have clients who we desperately want to help, but we don't seem to we don't seem to be able to.
You can talk all day long, but as long as the body is keeping that score, so to speak,
Right.
right, it becomes difficult. It's a lot slower. It lags behind.
And yet, if you go for this TMS treatment, it literally can change the way your brain functions.
Exactly. Really can.
Are we talking balance or rebalance here? Are we talking a reboot, rebalance?
David, that's a great way to describe it. That's exactly what I would say that it is. A rebalance, and in addition to perhaps a new way of thinking, so that you just don't get hung up in that trauma that just keeps you chained to that one place.
I have an old computer that sometimes reminds me of my old brain.
Exactly.
And sometimes, last night was one of those times.
Yeah.
I just had to reboot it.
Exactly.
I just wasn't doing right. And our brains have to have that too. And to know that this is a rebalance and restoration in your life, targeting the brain, man, how exciting is this?
It's so exciting. And we're just thrilled to be here today. And this has just been fantastic for your listeners because it helps introduce a really innovative and powerful treatment technique that we haven't had in this area. So we're glad to have it here.
Well, we're glad you're here.
Oh, thanks.
Kathryn and Benita, I've just got to be honest. I'm jealous. and the reason I'm jealous is, you guys are doing something where Monday morning gets here, and instead of saying the things that we normally say, you guys say, hey, it's Monday morning. We get to go help more people.
That's exactly
It's
right.
It's a new week.
Oh, it's just the most wonderful thing in the world when you see someone just make changes right before your very eyes.
Yeah.
And to leave and to become, they just say, my life is better now.
This is a new treatment option in Shreveport. It's called TMS. It is Transcranial Magnetic Stimulation. Yes, there's a lot of clients, but there's plenty of room.
Absolutely.
And so all you've got to do is give a call. You can find the number on the website, neurostemllc.com. In case you want to, write the number on the dust in your dashboard, I'll give it to you. 318-227-4088. Kathryn Thomas and Benita Collard from Neurostem with us today here on Strategies for Living. You ladies have to promise to come back.
Please.
Absolutely.
Okay.
Happy to.
We're gonna hold you to that.
Okay.
Folks, you check out Neurostem. This may be the best thing that I've heard of this entire year. We'll be back here on Strategies for Living. Stay with us. Welcome back in. Welcome back into Strategies for Living. Lauren Leon McMillan, David McMillan. Are you as excited as I am?
I'm ecstatic.
I'm
Yes.
fired up. I really am. Kathryn Thomas from Neurostem, Benita Collard, Marketing Director of Neurostem, Transcranial Magnetic Stimulation. Kathryn, we've covered a lot of ground today here on Strategies for Living. What is the one thing that you want people to remember about this conversation that we've had today? What do you want them to take away?
Well, David and Lauren, thanks so much for having us. And I think if there's one parting thought I would like to share, you don't have to suffer.
Yeah.
You just don't have to suffer. And come and get your joy.
Mm.
You know?
Yeah.
Let's get your joy.
Yeah. Even if
Yeah.
you've never experienced it in your heart, you can't remember the last time.
It's time.
Yeah.
Mhm.
Yeah.
It's possible.
It's time.
It's time and
possible.
it's possible
Yeah.
because there's a new kid in town.
Yes.
TMS, Transcranial Magnetic Stimulation.
Yeah.
The place is called Neurostem. It's
Non-invasive.
non-invasive, 745 Olive Street. Go to neurostemllc.com. Give them a call, 318-227-4088. I can promise you they are friendly folks. You know, they'll answer any question that you have. They'll show you around, and they'll even talk to you to see if this is right for you.
Absolutely.
Kathryn,
Thank
Benita,
you.
thank you so much.
Thank you.
Folks, thank you for being a part of Strategies for Living. We appreciate you, and we appreciate our sponsors who make it all possible. The Robinson Film Center, Azalea Cleaners, Pintail Roofing,
Roof, roof.
Restore Healing, SRT Sales Training, Uprising Addiction Center, and Mira Direct Primary Care. If today were the last day of your life, you only had one more phone call that you could make, who would you call? And what would you say? And why are you waiting? Make the call. For Kathryn Thomas, for Benita Collard, and for Lauren Leon McMillan, I'm David McMillan. See you next time right here on Strategies for Living.